All right, here are 7 decisions you may be asked to make during labor. If you're working on a birth plan, these are some things that you might want to consider. And these decisions often come when you're tired, uncomfortable, and just trying to get through contractions. So let's talk through them now before you're in the moment. Number 1, movement and positioning. You may be asked if you want to move, walk, or change positions. Without an epidural, you usually have more freedom to walk, use the bathroom, squat, or labor on a birthing ball, sometimes even in the tub, depending on your hospital. With an epidural, movement looks different, but it doesn't have to be zero. You can still change positions in bed, you can still use side lying, sometimes you can do hands and knees with support, or things like a peanut ball, unless there's a medical reason not to. So talk to your labor nurse and discuss what options you have to reposition during labor and help move labor along. Number 2 is pain management. This can include IV pain medications, an epidural, or gas and air, which is nitrous oxide, which some hospitals offer. It helps to take the edge off contractions, and it does wear off quickly. Not every hospital has it, so you can ask ahead of time what pain relief options are available. And remember, with the exception of maybe an epidural, you can change your mind at any point. With the epidural, you can ask to have it turned off if it's not something that you decide you want, or maybe it's like numbing the wrong part of your body, or if something else happens. But it is much more difficult to have the epidural wear off. It takes longer than, let's say, just turning off the nitrous oxide. So getting an epidural and changing your mind basically is going to limit you just a little bit more. Number 3 is cervical checks. These are not mandatory. You can ask if they're necessary, how often they're recommended, and you have the right to decline them altogether. Number 4 is breaking your water. You may be asked if you want your water artificially broken. This can, in some cases, help speed labor up. So you can ask why it's being recommended, what the benefits are, and what happens if you wait. Number 5 is labor augmentation. Things like Pitocin. You can ask why it's being suggested, what the goal is, and what alternatives exist. You can also always ask for time to decide if the situation allows. And as with most things, unless it's a true emergency, you can decline. And really, even in true emergencies, you can decline. But I will say one thing about our healthcare system, and that is for however often we fail with things like patient rights and respecting patients' decisions, I honestly and truly believe that where our medical system shines is in true emergencies. Teams are highly trained, they're excellent at their jobs, and our medical system does save a lot of lives in true emergencies. Okay, moving on. Number 6 is monitoring. This can be intermittent or continuous monitoring. You can ask what options you have and how they affect your ability to move. And number 7, who's in the room with you? You get to decide who is present during labor and delivery and when. That is anywhere from your family and friends who might be in the room. You can ask labor staff to have them leave at any time. You can have a request for no medical students. You can have a request for no nursing students. Like, you control who is in your room. If you have a nurse that maybe you're not vibing with, you can always ask for a new nurse. These are all things that are within your ability to change if for some reason you are not comfortable with the situation. Now, with all the things that we've talked about in this video, I want to point out that none of these things, if they're being offered, are likely emergencies. They're decisions that you have control or you have a say in. Don't allow yourself to be pressured into something that you don't want. You should be an active participant in your care decisions. Save this for your birth plan and follow for more mom-to-mom straightforward birth education.